Hello everyone, I am Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Many a times patient ask us what are the precautions to be taken in the first trimester or in the early pregnancy, what food we should eat, and in general what are the instructions when you have just conceived. So usually our patients who conceive with IUI and IVF, there might be some extra medications and extra care which we advise to the patient to follow throughout the pregnancy. But those who conceive naturally, there should not be many restrictions as such. What you have to do is just avoid outside food, junk food, too oily, too spicy food, because first trimester of pregnancy, where the symptoms of pregnancy like nausea, vomiting start coming, the woman may feel bloated up, she may have the acidity issues. So in such condition, it's better to restrict your outside food intake, which may further disturb your stomach or can cause acidity or can cause loose motions also sometimes. So try to have healthy home cooked meals. Also, first trimester of pregnancy, there is morning sickness or there is also aversion to certain food smells. So what you have to do is, for morning sickness purpose, if you have lot of vomitings early in the morning, we give certain medications which are specifically for pregnancy induced nausea and vomiting. So those medications definitely will help. When you're sleeping at that time, you can keep a pack of biscuits or toast near to your bed. When you wake up in the morning, maybe you can have 2 to 3 biscuits first before drinking any water or anything. So it will wash off the acids and it will help in morning sickness a little. So that will help you in getting your nausea, vomiting under control. Whatever smells you can't stand, you can avoid those foods. It's not compulsory that you have to have some fixed number of meals or you have to have so many calories in first few months, because if your body is not able to take it, if you're having lot of vomitings and if you forcefully eat, then it's not going to help. So if certain foods specifically is causing aversions, then you can definitely avoid those foods. Try to eat at least small nutritious meals and at more frequent intervals. So this will help, having small nutritious meals at frequent intervals. So this is what we advise for the food intake. Other than that, avoid too oily, too spicy food or too much of non-veg, because it is heavy on digestion. Traditionally, the foods which are considered hot like papaya, pineapple, mango, we advise to take it in small quantities or not to eat too much. Also, sometimes seafood, which can cause allergies, or if it is not fresh, can cause loose motions. Those foods we advise to avoid, especially the shellfish like crabs and prawns, to be avoided. Other than that, you should eat home cooked fresh meals, which are actually a balanced diet in the form of plenty of fresh colorful fruits and vegetables, salads, also good amount of protein, and have a proper liquid intake to maintain your hydration. Also, in first 3 months, if you're not able to eat too much, the baby is very small. Even if you don't eat many calories, if you are not even able to eat how much you were eating previously, also the baby usually tends to grow normally. So the food intake, usually when we advise to increase is after mid of your second trimester, by the time this nausea vomiting comes under control. But if you're having too many vomitings, definitely you need to consult your doctor to take treatment or also to rule out any other causes of vomiting. So this is about the food intake. Now coming to the activity. So usually our patients who have undergone IUI and IVF, we advise them to restrict their physical activity, because these are precious pregnancies and initial few months the pregnancies are dependent on the medications which are given in the cycle. So for that purpose, you have to maintain your proper medicines intake as advised by the doctor, and avoid unnecessary journeys on the bumpy roads which can cause jerks. And also we advise not to have intercourse for first 1 or 2 months. Once the pregnancy is well established, nicely implanted, then you can consult your doctor regarding these restrictions. And if your doctor advises you that you can travel or you can have intercourse, then you can definitely go ahead with those activities as well. Otherwise, you can continue with your daily routine. If you're going to office, if you're working from home, you can continue doing so. Just if you're sitting for longer hours, like more than 2-3 hours, then what you should do is, and after every 1.5 hour, you should stand up, do little stretching, walk around, so that will help in even the blood circulation, and you will not have backache in pregnancy. So this is about the restrictions in the physical activity. Other than that, if you want to do any sort of physical activity, you need to consult your doctor based on your period of gestation. Based on how your pregnancy is, doctor will advise you accordingly. But usually what we advise is this regular normal paced walks are usually allowed. The activities which may increase intra-abdominal pressure, like lifting of heavy weights, or even doing some exercises which involves a lot of jumping, those to be avoided. Swimming in all trimesters of pregnancy in public pools, we advise not to go for it, because the public swimming pools, even though they are maintained well, sometimes can lead to vaginal infections, which can lead to problems in the pregnancy, like miscarriage or even preterm delivery. So these are the activities which are to be avoided. Definitely you can have regular walks, some simple yogasanas you can do, pranayam you can do, and for specific activity you need to consult your doctor. So according to your period of gestation or according to your condition, doctor can advise you. Thank you so much.